Good morning and wish you guys a happy new year. Today is December 31st, 2025. And in this video, I'm going to talk about pulmonary embolism. One of you asked me yesterday to do a video on pulmonary embolism, so here it is. Pulmonary embolism is a serious and sometimes life-threatening condition that often comes with warning. Many people mistake it for anxiety, heartburn, pneumonia, but recognizing it early can save life. That means going to ER to get checked or seeing your doctor. So let's break it down in simple terms. What is pulmonary embolism? Why it happens? How to prevent it? And how it is treated, and what life looks like after PE. So what is pulmonary embolism? Pulmonary embolism happens when a blood clot blocks blood flow in the lungs. Most of the time, the clot starts in the deep veins of your leg, called DVT, deep vein thrombosis. It breaks off, travels through the bloodstream, gets stuck in the lungs. When this happens, oxygen level drops, obviously because blood flow is diminished because of clot. The heart has to work harder. Parts of the lung may be damaged. Large clots can be fatal within minutes if untreated. Common symptoms. Symptoms can vary, mild to severe. Classic warning sign, sudden shortness of breath, sharp chest pain, worse with deep breathing, rapid heart rate, coughing. Sometimes you have blood in your cough, in your sputum. You can have dizziness as well because the blood clot will lead to drop in blood pressure. Sometimes people just faint. People sometimes have leg symptoms, one-sided leg swelling or tenderness in calf, warmth or redness in the leg. But many times you don't have any leg symptoms, you don't even have DVT. So you have to be very suspicious about pulmonary embolism. So I'm going to talk about the risk factor. Usually occurs, the pulmonary embolism usually occurs due to blood clot formation. So what makes blood to clot? So the other important risk factor, most common one, prolonged immobility. Like for example, long flight. I was traveling from India, flight was 20 hours. I made sure that every few hours I was walking down the aisle and I was doing the tiptoe exercise called soleus pull to move the blood flow from my legs to my body. Bed rest, prolonged bed rest after hospitalization, after any sickness, injury, trauma, whatever it is. Recent surgery like hip surgery, knee surgery, any abdominal surgery, brain surgery, whichever leads to prolonged immobility would be a risk factor. Cancer and chemotherapy, pregnancy and postpartum period because of hormonal changes, some dehydration and immobility, hormone therapy or birth control pills, obesity is a big risk factor, smoking, prior history of pulmonary embolism or DVT, and genetic clotting factors, disorders. Key idea, anything that causes sluggish blood flow or increased clotting because of clotting factor issues or too many of platelets. Blood vessels injury because of trauma or surgery, they will raise the risk of PE. How is PE diagnosed? So we use combination of things. First is clinical suspicion, because if you don't suspect, you're not going to do it. So there got to be high clinical suspicion. Blood test, we check D-dimer. CT pulmonary angiography is a gold standard. We basically, it tells you which blood vessels in the lungs are blocked. Ultrasound of the legs to see if there's a clot. Echocardiogram is also done to see how much stress right side of your heart is bearing. Okay. Um, so PE is often missed despite having all the diagnostic um, tests available to us because of the low suspicion. Um, so symptoms plus risk factors matter a lot in emergency room or a doctor's office. What are the treatment options? Anticoagulant, blood thinners. Mainstay of treatment is heparin, warfarin in the hospital. Then usually these days now we use apixaban, which is Eliquis, rivaroxaban, those kind of medications are also we use them. Warfarin is also a cheaper option, but most of the insurance do cover other medication, a convenient one like Eliquis and Xarelto. And these medication prevent clots and allow body to dissolve the existing clot. Thrombolytics, clot buster, used in a hospital, used in life-threatening pulmonary embolism. It breaks clot quickly and but has higher bleeding risk, and you need ICU level of care. Selected cases, they also do catheter-directed clot removal, sometime in inferior vena cava filter if anticoagulation is not an option. Prevention is critical, especially if you're high risk. Stay active, walk during long flights or drive. I had a patient who drove from California to Seattle, and next day he had to come back, and he hardly had any rest, and he ended up developing PE. Similarly, I had a one patient who flew from Philippines, and she ended up having PE. So gotta be very careful. Hydration is very important, very important. Quitting smoking, maintaining healthy weight. Medication prevention, usually orthopedic surgeon, they provide you blood thinners after knee surgery or hip surgery for 2 weeks. Compression is stocking very helpful. Early mobilization in hospital is very helpful. If you had a PE before, never ignore recurrent leg pain or sudden breathlessness. Long-term effect of PE, most people recover fully, but some don't. Long-term complication could be shortness of breath, reduced exercise tolerance, chronic thromboembolic pulmonary hypertension because of blockage of many small, tiny blood vessels in the lung, anxiety or fear of recurrence, and need for long-term anticoagulation. Important thing is that you need to have regular checkups. Make sure that you take your medication as prescribed. Lifestyle change is very important. So, pulmonary embolism is serious but preventable and treatable. If you or someone around you has sudden breathlessness, chest pain, unexplained leg swelling, seek emergency care immediately because early action saves life. Like the video, share it, repost it, and thank you for watching. And again, Happy New Year. Wish you all the best and hope the new year brings good health and prosperity and peace in your life. Thank you.